Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Café. And today I have with me Constanza Roeder, and she's the founder and CEO of Hearts Need Art. It's a creative support for patients and caregivers. And she hosts a podcast called Arts for the Health of It. As a singer, adolescent leukemia survivor, speaker, and thought leader in the field of arts in health, Constanza is on a mission to humanize healthcare through the arts. Very much needed. Mm-hmm. And you're also the recipient of a 2018 Gracien d'Or Humanitarian Award, and you were selected as one of the top 100 healthcare visionaries by the International Forum on Advancement in Healthcare for 2021. And you've been featured all over the place, Thrive Global, Authority Magazine, et cetera, et cetera.
Et cetera. Skip that.
So, welcome.
Well, thank you for having me here. I'm excited to have this conversation today.
Yeah. So, I'm going to ask the same question I ask everybody else. Whatever got you into, I'm going to call it the healing arts, because literally, if you're using art for healing, it is truly a healing art.
Sure. Yeah. So I grew up in Santa Cruz, California. And when I was 13 years old, I was diagnosed with leukemia. And my treatment came with 130 weeks of chemotherapy. So most of my high school years, I was on some sort of treatment for my leukemia. And as you can imagine, that was a really difficult experience as a young person. It's difficult for anyone of any age. But I was really fortunate in a lot of ways to have been treated in a pediatric facility, and also in a place where I had access to the healing arts. So for example, there was a nonprofit in my hometown called Jacob's Heart, and they offered opportunities for teens and young adults with cancer to come together and create art. And that was a way we expressed sometimes what felt like inexpressible emotions. It helped us tell our stories and connect more deeply with each other. And that was a really profoundly transformative experience for me. And then also I grew up in a musical family. And so singing to each other in the hospital felt very normal, and it made us feel better. And so we did it. And so the arts were, like I said, were really important during treatment and getting through that. And then also in the recovery phase of figuring out how to pick up these broken pieces of my dreams and my childhood and moving into adulthood, and like, what was my life going to look like now? And the arts really gave me a way to externalize that and transform all these pieces into something beautiful. Like, what was this going to look like? It was a creative endeavor. And I went on to study music and psychology in school and college. And then I moved to San Antonio in Texas after I graduated. I married my husband. He's in the Navy, or he was in the Navy, and we were stationed here. And I started volunteering on an adult oncology unit, and I had never been in an adult hospital before, much less like an adult oncology unit. I'd only ever been in pediatric hospitals. And I was like, where is the art, and where are the activities, and where is the joy and the life and all of the things that I kind of took for granted as a pediatric patient in that type of setting. And there were a lot of the patients that I worked with were living on this one unit for weeks and months at a time. And some of the greatest suffering was coming from boredom and loneliness and just the anxiety and the depression of just being in this environment. And I knew that healthcare didn't have to look like that. And so I was like, well, I'm a singer, so I'll just start singing for patients. And I'd go room to room, and I would round with the social workers, and they'd take me to different patients, and I would sing their favorite music if I knew it. And it was amazing. It was the most sacred, beautiful transformative work. It was so cool. And what my patients told me every time I came was like, this is great, but we need more of it. We need this every day. And we would like other things too, like visual arts and literary arts and things that I didn't necessarily know how to do. So in 2016, I incorporated Hearts Need Art as a nonprofit here in San Antonio, Texas. And we identify artists and creatives that have a good temperament for this type of work. We identify them in our local community. We train them how to safely engage with patients and caregivers in a healthcare setting in the arts. And then we bring them into healthcare spaces, and our programs reduce loneliness and anxiety and depression and pain and burnout in healthcare providers, reduces the burden of care that's on healthcare providers and other caregivers. And it's been just the most amazing ride. And we're about to hit 5 years old later this month. And yeah, it's been so cool to get a front row seat of just the healing power of the arts.
So yeah, that's fabulous. Just to hear that. Now I'm thinking, two thoughts came to mind. What have you been, or I don't know, every state is different, every country is different, but what happened during the pandemic when at least, some of us were not allowed in, and then all of these things. How did you, or were you able to keep connected to?
Great question, Dr. M. So we were not allowed in person in the hospitals for 14 months. So from March 2020 till April, May of earlier this year, we were finally able to go back in. But when we first found out that we were going to have to be out of the hospital for an indefinite period of time, we converted all of our programming to a virtual format so that we could continue to work with whoever could whoever had access to us through private Zoom sessions with our artists, through group arts sessions. And we were live streaming different activities because we had a lot of participants that followed our social media. So we just like live streamed a lot of interactive content, and people kind of like connected with each other through that in those early months of the pandemic when most of us weren't leaving our homes. So we did a lot of different things to try to continue to connect and serve our different populations. And that was a really great time of growth for our organization. And we've been able to connect with and support groups from around the country that we wouldn't have had access to otherwise. And we're able to continue to support them now, which is great. And now we're able to provide a continuum of care for our patients that we weren't able to provide previously. So like we work, for instance, with a lot of oncology patients that have multiple admissions in the hospital. So they might meet our visual artist, Hannah, in their first admission and really connect with her. But when they go home in between admissions, they're too immunocompromised to go out to an art class or to go to a concert or really engage in the arts in that way. So now they can go to our website and schedule a session directly with Hannah, continue to work with her on Zoom while they're at home. And then when they come back into the hospital, they just like pick right back up. So we're keeping aspects of what we did during the pandemic because it's enhancing the work that we're doing now.
Wow, that's great. I mean, it's exciting because it's not like it had to stop. It changed and then flourished. And was there an opportunity to sort of assess the impact it really had? Like, were there any research or any interest in actually seeing?
Sure. Yeah, that's a great question. And we offer a survey to all of our participants after they engage with our program. And we found that, so we asked them questions like, did you feel like this program improved your mood or your pain levels or any feelings of isolation? Did you feel more connected after this activity? Did you feel entertained? Things like that. And we were using some of those same assessments for virtual activities as well. And we found that there were very similar impacts, which was really great because we didn't really know what we were going to find.
Right.
But the one factor that was consistently lower was isolation, that it did positively, it did help people feel more connected, but not as much as being in person, which
Exactly.
that's not surprising at all. But people were still reporting that they felt less anxious, and they felt like they had fewer depressive symptoms and lower pain levels and all of the stuff that we were seeing in the hospital. And there's starting to become some research coming out of the pandemic from the field of arts and health that is showing some similar stuff. So it's great in a pinch, but we would much rather, and it's much more effective to be in person.
Mm-hmm. Well, it's also directly almost the human contact, right? Like,
yes,
whether you're touching or not, you're actually really there,
yes.
it's different for sure.
Yeah.
So out of all the different arts, like maybe what are the arts that were, first of all, part of the program?
Yeah, so we really work hard to build programs around the requests of our patients.
Mm-hmm.
So we started with music because that's what I did. But then, our patients wanted visual arts. So we started our first visual arts class, and we were doing bedside art as well for those patients that couldn't leave their rooms. And then we added, for a period of time, we did a music and movement activity. And that was really popular for a while and then kind of faded away. So then we replaced it. People were asking for more writing activities. So then we brought in a writer in residence. And so it tends to flex. And but we work to find creatives that have a lot of flexibility and a lot of versatility in their art forms, and even able to bring in other art forms into their work. So that when, for instance, we just brought a new poet in residence on our team, but she has a lot of background in theater and some music and other types of writing skills. And so she's the perfect type of person, because when she goes into a room, there's lots of things that she can offer, because patient preference and choice throughout that process is really important. It's it's part of that empowering piece where we're honoring the personhood, which so often is diminished. And when you're in a hospital and you're in a healthcare space, you become a diagnosis, they take away your clothes, you're in, a sterile environment, and not just like no germ sterile, but like doesn't necessarily look nice sterile.
Right.
So giving agency and choice back to our patients is really important. And that actually starts at the very beginning of the interaction, whether or not they even want to do the activity. So we never see no as a failure. Like if we go in and like, hey, do you want to do X, Y, or Z today? And they're like, no. And we're like, great, excellent. They got a choice today. That may have been the only thing that they could say no to that day.
Mm-hmm. Yeah, it's making me think, with all of this, what's in common with all the different arts. I mean, it's one, I think you're right, choice. It's like, I decide to do this or not, and then I choose which one. But it's about creation, right? It's using creativity, and creation puts you in another space, emotionally and mentally. When you're creating, you're actually participating in a completely different way than so-called entertainment.
Correct.
Where you're the recipient of watching a show, which it could be fun, but you're not necessarily in the creative energies, right? So I wonder if that's a piece of all of the
each art form kind of has a different bent and a different way it impacts us when we engage in it, and the setting in which we engage in it also affects how it impacts us. So what I could sing by myself, and that has physiological impacts on my body. It helps to stimulate my parasympathetic nervous system, helps to boost endorphins, positive endorphins in my brain. It helps to lengthen my exhale, which is a very calming experience for the body. So those are all beneficial things. But when I join a choir and I'm singing with other people, there's this whole added dynamic that is added on top of just the individual act of singing. So the type of arts we're using and the setting of that we're doing the arts in will have different impacts. But yeah, there's that element of, excuse me, of expressivity. So having opportunities to externalize hard emotions that would otherwise get trapped in our bodies. Because when we're going through traumatic experiences, we can't usually verbalize what we're going through at first, because a lot of those memories are encoded in kind of the more subconscious part of our brain, in where more of our visual auditory processes are. And so when we engage in visual arts, it can help us, even for the first time sometimes, realize even what we're feeling. And then we can then verbalize it and reintegrate the brain. And that's really incredible for trauma recovery, and has lots of applications in like PTSD recovery for war veterans.
Hi, I'm Dr. Manon Bolliger, and I wanted to take a moment to thank you for watching these podcasts. If you haven't subscribed, please do. Also, feel free to leave comments and like it. This way more people get to find out about this work and about other choices for health. So I think it's really important that we all share this information. I have a free gift to you. It's a 7-sequence email that has tips for every day, and it's a little insight about how to live your life when it comes to health. And it's very much built on how I managed to overcome stage 4 cancer and what it took. So I would love you to have this, and thank you once again for listening to these podcasts.
For example, so there's expressive part of it that is so important for just general mental health hygiene, I might say. And then, like you said, that there's the passive forms as well, where when we're taking in other people's art, there's something else that happens. So for example, when I was sick, and I was really feeling gloomy, I would listen to Mozart's Requiem on repeat. That was my jam. And I would cry and I would get it all out. And it made me feel less alone, because here was this composer that was externalizing what I was feeling, was verbalizing in the language of music what I was feeling that I couldn't always say, or maybe didn't have the tools to say so eloquently. But then now I'm hearing it reflected back at me. And then I'm like, oh, other people have felt this too. And so you feel less alone. And then take that into the hospital where, let's say I go in and I'm working with the patient. They don't have the energy to do anything participatory. They're just barely awake, laying in their bed. They're not going to be writing that day or doing a music lesson that day or anything. But let's connect over, like, what's your favorite music? What do you like to hear and listen to? And why do you like to hear those songs? And then let me play it for you. And from what I see is, it's the difference between saying I love you to someone and singing I love you to someone. And music is such a whole brained activity. Listening to music, it lights up the whole brain, and it imprints truths on our hearts that at levels that we can't get to really in any other way. So I know this is a long-winded answer to your comment, but they're complex interventions that have ripples effects and kind of holistic impacts to the person, to their spirit, to their emotions, to their body, to the community around them.
Mm-hmm. I mean, that has to have an impact on,
yes,
like there's no way around that.
Yes.
Yeah, and often it's not like, yeah, when you look at just the physicality of, okay, here's take these drugs or even take these vitamins, though vitamins can be because you're missing them and we need them, they're substrates, sure, but yeah, it's a whole other world when you sort of realize that we have body, mind, spirit. Yes. We have oneness, we have connection, we have vibration. There's so much more going on. So out of all of your experiences or through the people working in your team, what's this one example or a story that really just gave you further commitment to the impact you're having?
Oh gosh, it's so hard to pick. Dr. M, it's really hard to pick just one, because it happens every time. Yeah. Every time I go in and play music with patients, it's a spiritual transcendent experience, and that is addictive in a lot of ways, because through so much in our everyday life, there's just can I use a cuss word on your podcast? Or would you rather me reframe? There's like a lot of bullshit that is in kind of normal life. But when you're in a hospital, when you're on like an oncology unit, people are facing life and death, and you're going in during these tender moments of someone's life and you're singing their favorite music to them. There's nothing else like it. And it's the most beautiful and sometimes brutal work. But I'll share one story that kind of connects with the comment you made just a minute ago about kind of like these holistic people. When I was, you mentioned the award I received earlier this year, Top 100 Healthcare Visionaries. When I went to go receive the award, I got to meet the other awardees, and we had lots of sessions and discussions with each other. And one of the main concerns that kept coming up over and over from the medical side of it, was compliance. Oh, we can't get patients to do what they need to do, blah, blah, blah. And I just got the impression that they were just frustrated because the humans weren't behaving like their data models said that were supposed to, like, just do the thing, and then they'll do the thing, and then that's the thing, and then they get better. And it made me think of this one interaction that I had with a patient. And this is just an example of something that happens fairly often. When we're on the unit, the healthcare team, the nurses, the doctors will come and find us and refer patients to us for various reasons. And one of the common reasons that we receive referrals is for patients that are either really crabby, maybe even combative, non-compliant, that just aren't jiving with their care team. And they come in and like, hey, can you like play music? So this one day I went in, and sure enough, a nurse came and found me, and there was a patient on the BMT unit, the bone marrow transplant unit, who had refused to take a shower for 4 days. This was the 4th day that he'd refused to take a shower. And that's a real health risk, because when you go through bone marrow transplant, you have no immune system, and daily showers are essential to prevent hospital-borne infections. So he had refused to take a shower. He had kicked his doctor out of the room. He had kicked his nurse out of the room. He wouldn't let anyone in his room. He didn't take his meds that day, and they didn't know what to do. So they came and found me, and they're like, hey, this is the situation. Can you go in and just like see if he'll let you play music? As non-threatening, right? You're not trying to get him to do anything. It's like, sure. So I went in and I knocked, and I was like, hello, who is it? It's Stanzi. I'm here. It's like with the arts team. Would you like to hear some music? And he's like, oh, sure, you can come in. So I went in with my little keyboard, and I set up my stuff, and was like, well, what kind of music do you like? And he shared about classic country and oldies and all this music and all this history. and how it connected with his life. And then we played it and we were singing and laughing and clapping and having a great time. And when I left, the nurse went back in and he agreed to take a shower. He agreed to take his meds. He agreed to let his doctor come back in and examine him. And I think what happens so much when we're going through hard experiences, when we're going through trauma, we put up armor to protect ourselves because we're scared. And so often that happens when we feel disconnected as well. And what these types of music interventions do is the music has this way of kind of flowing through the cracks in the armor and caressing the person behind the armor and help them feel connected with and heard and seen in a really profound way so that they can feel safe enough to start to let down some of that armor and make better decisions for their health and well-being. So if we continue to treat humans like petri dishes, that they're not whole, complex human beings that have emotional, psychological, spiritual needs, our patient outcomes are going to continue to lag. We can have the best medicine in the world, but if a patient's brain is too on fire because they're scared and they feel lonely and disconnected, they're not going to be able to take advantage of all that technology.
Yeah, no, absolutely. It's like we're far more than a stat, you know?
Yes.
That's why, you know, if you look at what the stats are on whatever condition or disease, it's like, really, where did they get that? Because, you know, I know from friends and also patients who have, you know, have had cancer or have had to deal with that. It's like, all they're looking at, did the drug work? They didn't ask, what else in your life did you do or change, or what were the circumstances? Did you do anything? And it's like, so many have said, no, they had no interest in anything about me or my life, just on, you know, whether I'm going to accept this chemotherapy. That's it. You know? And it's very hard because I agree, there could be better results with any medicine, you know, once you start treating people as people, and maybe even reduce some of the medicines because you're not fighting against the person, right? Like, you know, I do think there's no such thing as this is the quantity and therefore it has this impact. I think there's a big, you know, discrepancy between our ability to absorb anything, you know, if we're completely closed.
Absolutely.
You know, so yeah, it's very interesting to, I love how you're explaining the way that music sort of goes in and cuddles. It's in my own words.
Yeah, no, I love that word.
Cuddles your wound itself, really, your vulnerable part, you know. And it makes me think too, how many times people listen to musics that make them cry, you know, and you know, people often say to them, and I've heard this so many times, oh, just listen to something happy. But it's like, no, if you really know that people choose their musics, right?
Yeah.
You know, if you need to cry, it's doing something. It's like, you know, in the law of homeopathy is like cures like. If you are giving something similar, like in your situation where you're the vibrations, the intensity, the beat, all of that is resonating literally with the unspoken word inside your body. You know that you're helping yourself, right? And I think, you know, patients know that. You know, so
it's funny you mentioned that, because when we've had guest musicians or groups in the past come and want to play music for our patients, we have to brief them before they come to the unit, especially when they come to the oncology unit, because they think what you just said, like, oh, we're gonna bring happy, uplifting music, and it's gonna make people all better. And I'm like, no. That's like, have you ever been really sad and heard laughter? Like, it's painful. It's painful. But when, like heals like, when someone comes along and reflects back what you are feeling and sits in that uncomfortable space with you, it's incredibly powerful. And, if you're familiar with the Disney movie Inside Out, have you seen it? Where like sadness just goes and sits next to, the imaginary character, I can't remember. Anyway, and that's what made him happier. Like when she just went and sat with him and she's like, yeah, this sucks. And yeah, that's sometimes what we need to do. And I think one of the more profound moments, we had a member from our San Antonio Symphony come, the group, little duo, and they brought music from Schindler's List.
Wow.
And they were hesitant about it. They're like, we brought this, we didn't know if it was appropriate. And I was like, they're going to love it. And they absolutely did.
Wow.
Yeah. Just because like it was so reflective, and then gave them this cathartic, safe space to release and have this moment of, anyway, it was so cool.
But it's a principle of nature, right?
Mm-hmm.
Like, when Hanuman invented homeopathy, or he's the father of this system of medicine, it is like curing like. So what you do, you give a little bit of the same, which allows the person then to kind of overcome what they're experiencing, right? And this is true of whether it's flus or any similarity. It can't be flu remedy. It's like, how do you live your flu? Do you have diarrhea, or do you have hallucinations and high fever, or whatever it is? But it's like, it's the unique expression of how we are. And then these remedies, there's about 5,000 of them. You find the one that's the most like their current state. And then the body just, in a sense, expels it. It's like, okay, that's just more than enough right now. And it ignites the, your immune system and your innate healing intelligence, and people get better. So it's actually it's interesting. I've seen it in music, but listening to you, I get that now on a whole other level. So I really appreciate that.
Yeah, well, and thank you for describing that connection with naturopathic medicine. That's really cool.
Yeah, it's homeopathy specifically.
Oh, I'm sorry, homeopathy.
Yeah, no. But yeah. Our time is up, so but I've learned so much, and thank you for the work you do.
Of course, thanks for chatting with me about it. It's been great.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.